Well, this pandemic is ever changing and it can be an information overload at times, and some of that information isn't even true. So we take this part of our show to feature a local expert and ask questions from you, our viewers. Tonight, as on most Tuesdays, we have Dr. Ruth Berggren with UT Health San Antonio's Long School of Medicine. Dr. Berggren, thank you so much for joining us.
Happy to be here.
So my first question is about Remdesivir, which is showing a lot of promise when it comes to COVID-19. We know that the government has shipped us some in San Antonio already, and we're about to get more, which is what we've been reporting today. I know it's not obvious exactly how much we have here in the city, but how is it distributed? I know you have some input on that.
Well, we asked a lot of questions early on, and we did learn that this drug is being allocated across the country to the places of greatest need. So the amounts that are being distributed state by state are supposed to be driven by the need, the caseload of patients in those particular states. And then within the city of San Antonio, we have some really good infectious disease specialists who are also leaders, and there's a group of us that have a leadership call every couple of days or once or twice a week anyway, and we talk about all the issues where we might be able to make input. And one of them has been a discussion of how to make sure that we understand where the need is within the city of San Antonio to make sure that we get the Remdesivir to those hospitals that have the most cases. And so that kind of requires having a dashboard and a lot of shared information and good communication so the drug gets to where it needs to go when it needs to get there.
And that leads us to our viewer question, actually, which is how does the government determine how much goes to each state and city? So you talked about caseload. Is there anything else that can determine that, or do you feel like San Antonio has more than some of our other Texas cities?
Yeah, I don't have any actual granular numbers about what goes where. I know that when it first got the emergency use approval, we were all on the phone and calling up to Austin and calling representatives to make sure that we were in the mix. We particularly wanted to have a voice because University Health System and UT Health were participants in the trial. We enrolled quite a few patients on the clinical trial that helped get the Remdesivir approved. And after our calls, we learned that great effort was being made to distribute the drug according to where there was need, and that meant numbers. Now, you know, we've been flattening the curve here in San Antonio. Hooray, that's good. That means that we're not going to get the largest loads, but we have been getting Remdesivir because we do have cases, and we're ready to use it properly.
Flattening the curve, always a good thing here in San Antonio. We've been great about that.
Need to keep it up.
All right, so let's move to a different drug, hydroxychloroquine, which has been a huge issue when people talking about, you know, there's obviously been some conflict with this. The World Health Organization actually just pulled its study on this. We have a lot of viewer questions. So our viewer question is, what is the biggest concern with hydroxychloroquine?
Well, first of all, a huge trial. This is actually a retrospective look at multiple hospitals, over 600 hospitals in multiple countries, provided data on 81,000 COVID patients who didn't get any hydroxychloroquine and roughly 15,000 who either got hydroxychloroquine or chloroquine plus or minus the antibiotic azithromycin. So that's comparing 81,000 who didn't get anything to 15,000 who did. That's a really powerful number that can get you some important statistical significance. And what we found is that clearly mortality is increased, and it seems that some of the mortality is related to toxicity of the heart. So the virus itself affects the heart muscle and causes a lot of inflammation there. And then in addition, chloroquine or hydroxychloroquine can cause heart rhythm abnormalities and those drugs themselves can be toxic to the heart muscle. So when you get that combination of a drug that can do it by itself and a virus that's causing problems in the heart muscle, that is a bad combination, and the numbers speak for themselves.
Yeah, absolutely. And thank you for that, explanation. I feel like that's been a lot of confusion about that. We're talking one side of this is treatment. The other side, though, is reopening the economy. And that's been something that has been so debated. How quickly do we do this? Obviously, it was just Memorial Day weekend, people crowding areas. And then on a day-to-day basis, we're seeing quite a few people out there. Our viewers want to know from the experts, do you think there are too many people out right now on a daily basis?
So it just depends on what you're doing when you go out. Please understand that we want doctors and people who understand health and the relationship between health and economic prosperity. We want the economy to function. It is very critical that the economy function, but we have to do it in a new way. And that means when you go out, you wear a mask. It means you respect the guideline to socially distance and do stuff outdoors as much as you possibly can. Being outdoors decreases your risk, but if you crowd up next to each other, touch each other, pass cans of beers back and forth, don't wash your hands, then you're going to ramp that risk back up. The benefit of being outdoors goes away if you're crowding. So this can be done. I have personally been going to stores. I've gotten my hair cut. I had to go and get my car inspected today, but I know that I'm behaving differently. I'm hand sanitizing when I get in and out of my car. I'm putting my mask on and I'm respecting the space around other people. So we can do our business. We just have to respect each other and take care of each other. And just tell yourself, instead of having a negative feeling, being offended by having to wear a mask, think about this is one thing that I can personally do in the world to try to help us all fight COVID-19.
And at San Antonio, we've always been a helpful community, and we've seen that with our flattening of the curve. So that's really positive.
Yeah, and we need to keep it up.
Yeah. Is there anything else that you'd like to add? Any last thoughts before we go?
Well, I do want to say that I am encouraged that the Remdesivir drug got emergency use approval. I'm happy that we're getting it. Don't think it's a cure. It definitely reduces mortality. It reduces the time to recovery from about 15 days down to 11 days. Mortality rate went from something close to 12% down to 7%. So that's not eradicating mortality from the virus, but it's definitely reducing it. And that gives us hope because there's a lot of people that will be helped by this specific drug. But I guarantee you, we're going to get more drugs. We're going to get drugs that will be added to that drug, and we're going to get better drugs. So I have a lot of hope, and stay tuned, but look carefully at the data, look at the science, and follow the science.
Dr. Ruth Berggren from UT Health San Antonio's Long School of Medicine, thank you so much for being with us.
Happy to be with you.
We'll be right back.